going to do is we're going to sterilize with light and just sew right over. It'll be extremely cosmetic. And so this is on 5,000 hertz, and we're using it for superficial sterilization and also as a numbing effect is what we're after. Using the blue light for its antibiotic properties because it's in the ultraviolet frequency range, and the red light is pulsing at higher frequencies of 5,000, so it acts more like an anesthetic, and that's going to help us to just moderately sedate and be able to patch him up.
And we started doing the laser treatment after trying steroids, which did not work. Started off doing it 5 days a week, then we went to 3 days, and then eventually 2, and then 1, and then we stopped for a while. It's been unbelievable, the progress that she's made. She now walks on all 4 legs, she puts her weight on it, and now we're going to go back to a maintenance where we come in every other week for a session.
I didn't believe the potential of it. I did a lot of study on it too. I don't believe in just taking what someone tells me about a product. I have to do my own research. And the fact that it can be used to for antibiotic resistant bacteria is huge. This is going to be the future.
This is when you get into these other modalities, you'll find that sometimes these treatments work much quicker, much safer, and you get much less side effects with it. And that's the reason my practice has grown tremendously. We can't just be dealing with patients and just be giving antibiotics and steroids all the time. Because eventually, you know, what we're running into is these super bugs that basically are becoming resistant to a lot of different antibiotics. We're finding the steroids basically put a band-aid on the problem, but they don't solve the problem, and it just makes things go deeper into the body. And so when you get into integrated medicine and you're using laser therapy and all the other integrated properties, modalities that are out there, you start getting down to the root of the problem and solving the problem instead of just putting a band-aid. I use a lot less drugs than I used to. One of the things, like I say, a lot of the clients that are coming to me because they've tried drugs and they've tried all different types of medications and nothing has worked on them. I see a lot of allergy problems and skin problems. I see a lot of ear infections, arthritis, that they've been on a lot of different medications. I had a dog yesterday that had severe arthritis that basically they've tried every kind of pain medication so far. We had acupunctured and lasered the dog, and when the dog got done, he was just walking around. She says, I haven't seen the dog that relaxed for years now. So it makes a big difference. I've used it for post-op surgeries. Almost all my surgeries post-op will get a laser therapy on the surgery site, and I get very little infections on those anymore. Used to get dogs that would lick at suture sites. They're not licking at the suture sites anymore, and the lasers tends to improve the healing on these. Sometimes even they heal about a third the time. It was a much more difficult thing to get that concept across to my mind because I had been taught so well on traditional medicine. I'd give them antibiotics and give them steroids and things like that to help them, and it did help, but I still wasn't getting to the root of the problem. What I'm finding now is I'm getting to the root of the problem and solving the problem, and the animal's much healthier and living much longer and with much less drugs.
Another of the unique features about the Multi-Radiance ACTIVet Laser is the inclusion of this wonderful nanometer, this 470 nanometer blue light. 470 nanometer blue, if you do a Google search on that, you'll find there have been numerous studies that show that this particular wavelength of light is very effective against bacterial infections, including MRSA. And as we all know, drug-resistant bacteria is a real big issue in hospitals of human and veterinary. So using blue light to ward off infection after a wound, after an operation, extremely important. There are no reasons to wait other than if there's still an active hemorrhage, but after a surgery, along the incision line to speed up the healing and to prevent infection, using the Multi-Radiance ACTIVet Blue Radiance 470 nanometer blue, very effective to prevent infection. And then, in fact, we do it right here. We'll just pulse this. You now have the red light, and then we just add blue by depressing that button. And now, in addition to warding off infection or fighting active infection on a wound, not blood-borne infection, but on a wound, you're using the blue light against the infection and the red light to stimulate and accelerate healing. A wonderful, very synergistic combination to help you recover faster.